The doctor is in. I'm Dr. Freddy Gomez, and this is Med Talk, Health Talk. President Rodrigo Duterte vows access to healthcare for every Filipino. And 3 years into his presidency, Med Talk, Health Talk takes a look at how his administration puts premium on health.
By automatically extolling our citizens into the National Health Insurance Program and expanding PhilHealth coverage to include free medical consultations and laboratory tests. The Universal Health Care Law that I signed today will guarantee equitable access to quality and affordable healthcare services for all Filipinos.
Signing the Universal Healthcare Law is the President's most significant move this year, following the passage of the Mental Health Law last year. And one of the highlights of the UHC is the automatic enrollment of all Filipinos to the country's health insurance program. This means that primary health care will be more accessible, convenient, and most importantly, quality health care that Filipinos deserve.
Sa first year of implementation, hindi naman ito nationwide rollout. Dito muna natin papalaganapin ang universal healthcare sa mga piling mga implementation sites.
However, the said law would require the government to produce more than 250 billion pesos to implement the law. The government looked at sin tax from tobacco and alcoholic beverages to augment the fund. Is the Universal Healthcare Law the answer to the most pressing needs of the country's health sector? And to talk more about this topic, we have on the program Dr. Shirley Domingo. She's a spokesperson and Vice President for Corporate Affairs Group of PhilHealth. And we also have Health Undersecretary Mario Villaverde. Welcome to the program, doctors. Now, compared to other or previous healthcare programs, USEC, how is the Universal Healthcare Law of this administration any different?
The Universal Healthcare Law is actually built on so many of the previous reforms that we have done in the health sector. This is started with the Local Government Code of 1991 when we devolved our health services to the local government units. And this was followed eventually by the enactment of the Philippine Health Insurance Act of 1995, which actually mandated PhilHealth to enroll everybody for our universal health insurance coverage. But there were so many reforms between the enactment of those laws and since the enactment of the universal health care.
So the current UHC is parang a improved version of previous healthcare,
Yes,
where its basis are previous healthcare.
We started with the health sector reform agenda, and then this was followed by the next medium term, which is the Formula 1 for health, and now we are in the second phase of the Formula 1 for health, which we have included the Plus,
Okay.
which is actually for performance accountability that we as health providers, as health workers, should be accountable to the Filipino people.
Okay. Now, one of the big things about the current healthcare system is primary accessibility for Filipinos. You know, yung pinakamahirap, the poorest Filipinos are not able to access even the most basic healthcare services. How can this be addressed?
Universal healthcare is a package of extensive reforms in the whole health sector. No, and primarily, it addresses the issue of access by everyone, especially those who are in need,
Right.
to affordable and quality basic health services. So maraming provisions within the law that assures that. No? And then that provision that says that 90% of beds in government hospitals are basic accommodations and that there should be no balance billing. That's also true for 70% of beds in specialty hospitals and 10% in private hospitals. So with that, there can be more access of people in need for hospital services.
So, do you think, Doktora, ang mas makakaramdam ng itong UHC or Universal Healthcare Law, yung mga mahihirap lang, yung mga hindi nakaka-afford lang dati, sila ba yung parang pinaka-main target nito or all Filipinos in all walks of life?
Universal health care will address reforms for all Filipinos, but of course, we have to have focus on those who really need it, no, economically speaking, because kami ay financial institution nga, no, and we want to give financial protection to especially to those in need, no. Ano na lang natin, gawin natin practical, no, like somebody who's very rich can afford private health care, but somebody who is not that economically, well off, they need assistance in terms of paying for medical services. Of course, we put more resources towards that portion of the population who needs our help.
Okay. Now, Yusek, according to Secretary Duque, the first rollout ng UHC will be in selected cities muna, no? Have these cities been selected already?
Initially, we will be implementing this in 33 sites. That's 33 provinces and highly urbanized cities. And the main basis is actually the readiness of the sites to be the initial implementation sites. And of course, the willingness to participate to implement the provisions of the Universal Healthcare Act.
Now, Doctora, what is the exact role of PhilHealth in implementing the Universal Healthcare Law?
PhilHealth will become the strategic purchaser, meaning in behalf of the members, which will be everyone already in the population, we can be able to bring down the prices of health services, and we can also set policies such as co-payments, fixed co-payments. Ibig sabihin, when they go to the hospital, they'll be able to know how much exactly will they bring out of the pocket. That's a big thing for us, no? And also the implementation of no balance billing. It means that if you're in this type of accommodations, we should be able to monitor that they're not paying any more out of the pocket because that's part of the law. And of course, we'll be able to provide some services, especially for primary care benefits. The law actually gives importance to primary care services.
Okay.
Yes.
It's good that you mentioned some of the services and how some of these will not require any more payment. We'll talk a little bit more about that after the break, especially amid some controversies that might come up. Now, after the break, President Rodrigo Duterte recently appointed a former military official to head the PhilHealth. What are his plans for the agency? Let's talk about this when MedTalk Health Talk returns.
I'm looking into any culpability of an employee of government joining or in cahoots or in conspiracy.
The discovery of alleged fraud in PhilHealth's claims, which amounted to reportedly over 150 billion pesos, paved the way to the appointment of retired Army General Ricardo Morales as new president of the health insurance arm of the government. Will it make a significant impact in resolving the issues inside PhilHealth and in making sure that the budget allotted for its programs will be used properly? And to discuss this matter, still on the program, is Dr. Shirley Domingo, the spokesperson of PhilHealth, and Health Undersecretary Mario Villaverde. But now joining us is Dr. Oscar Tino. He's the chairman of the Philippine Medical Association's Commission on Legislation. Welcome to the program, Doctor. Now, before we talk about the new leadership in PhilHealth, the Universal Healthcare Law requires over 250 billion pesos, actually 257 billion pesos. Yusek, how are we actually going to achieve this amount?
Well, the law itself is quite clear on the sources of financing for our Universal Healthcare Act. Well, of course, there are already existing funds. These are the ones that are being allocated to the DOH's regular budget. There's also currently a big amount for subsidizing the enrollment of the indirect contributors to PhilHealth. But of course, we need some more. And proceeds coming from PAGCOR, at least 50% of the national share of PAGCOR will go to PhilHealth. Another source will be the PCSO, which is, I think, 40% of the charity fund will go to the universal healthcare. And then, of course, we also have the sin taxes.
Now, of this 257 billion, magkano naman ang mapupunta doon sa PhilHealth?
Of the 257 billion, 150 billion will be coming into PhilHealth, but as premiums. You mentioned that the entrance of our new president was because of this
amid some controversies, which was reportedly 150 billion.
Okay. The 154 billion, which was mentioned in a major daily. I just want to clarify that that report says that this 154 billion was taken from a document from northern Mindanao, no? But a review of this document shows that there is no such statistics as 154 billion. And even a 50 billion loss to fraud. There's no statistics of that in that document. So that has to be explained by whoever wrote that article.
Okay, now it's good we got that part of the story clear.
Yes.
Now, moving forward to some of the coverages or expectations with the universal health care. And one of them, Dr. Tino, is that future patients are already excited to having free consultations, free medical diagnostic packages. How do you think will this be addressed when the current hospitals, both public and private, is very congested as it is?
The government sector cannot do it alone. We'll have to be part of this. I think majority of the part of providing for universal health care probably might come from the private sector or from the medical association members of the Philippine Medical Association. So we have to work together and devise a way in how we can meet the needs of the influx of patients when the law is implemented.
Right.
And I think we do have to discuss this thoroughly with the Department of Health. We have no specific plans yet, but we would like to sit down and talk things out and see how we can do the transition very well.
One of the hearsays or one of the things that we hear lately is the corporatization of some of the public hospitals. Do you think this is a good move, or is this an avenue that the DOH will be looking at further in the future?
I think we should clarify what corporatization means. And this is generally not privatization. There is never a talk about privatizing our public hospitals. Corporatization means we just improve on the management system, looking at the example of corporate entities so that there will be more accountability and so that there will be more fiscal autonomy among our public hospitals. No? And I think that with fiscal autonomy, the revenue that they get from paying patients will be retained within the hospital, and this can be the one that will be used for subsidizing better technology, better equipment, improving the infrastructure, as well as subsidizing also the service provision for our more indigent patients.
Okay. You said, will corporatization be able to address the congestion that is seen now in public hospitals?
Somehow, if we improve on the management system, but right now, we are not pursuing any of these reform efforts now. No? We're just concentrating on how best we can improve the services through our universal health care.
Very well said. We have to pause for another break, but before we do that, are there any final messages you have for our viewers, Dr. Domingo?
PhilHealth is still forging forward in our journey towards universal health care. We want to bring back your trust in us because in this past year especially, we have been implementing a lot of reforms to make sure that the money entrusted to us is put into well use. We also have reforms in the area of IT. It's very important. Automation of our system is very important in the area of finances, claims management, and all that, to make sure that our systems is prepared to handle finances given to us and additional functions given to us under universal health care. Therefore, we are still moving forward, and we're still continuing and improving further our service to our people.
Yusek.
Well, universal health care will have a long way to go, but basically, we want to start as early as this year. We are trying to finish the implementing rules and regulations so that there will be some areas that we can implement immediately. But our horizon is that in the next 3 to 6 years, we will be able to implement the intent of the law.
Thank you very much for clarifying several things. PhilHealth spokesperson Dr. Shirley Domingo, thank you for joining us on the show. And of course, DOH Undersecretary Mario Villaverde. Thank you again for explaining to us a lot of aspects of the UHC. And now when we return to the break, we'll still be joined by you, Dr. Tino, for some further inputs. And when we come back, access to hospital and medical practitioners remain a challenge for many Filipinos, especially those in the far-flung areas of the country. How will the Universal Health Law address this problem? We'll talk more about this when Med Talk Health Talk returns. In this portion of our discussion, let's talk about the factors that contribute to the poor health-seeking behavior of Filipinos. Why is this more common in remote communities? And to discuss this topic still with us is Dr. Oscar Tino, the Chairman, Commission of Legislation of the Philippine Medical Association. And joining us now in the program is Ms. Karen Villanueva. She is from the Philippine Alliance of Patient Organizations, or PAPO. Welcome to the program.
Thank you, Dr. Gomez.
And we will first address some of the factors that contribute to the poor health-seeking behaviors of Filipinos. Just to clarify this, ito yung kaugalian ng Pilipino na pumupunta lang sa doktor, tumitingin lang para sa health nila pag medyo malala na, pag sobrang may nararamdaman na sila. Why do you think is this the case?
I think there are several factors, no? One is accessibility to a health facility. Obviously, if there's nothing near to them, it will be very hard for them to visit a facility. In fact, there's a study that shows that on the average, it takes about 100 pesos to access a health facility. Number two, I think, is also the issue of affordability. Of course, when you go and consult a doctor, you would expect some form of treatment because, as you said, malala na. And therefore, they would have to think, do I sacrifice that day's food to be able to access healthcare? And lastly, I think also it's pretty much cultural. There are also issues about beliefs. Diba? In the remote areas, there are cultural beliefs that prevent people from accessing health.
Now, Dr. Tino, what is the best way for the UHC to be able to target these communities or this demographic?
Actually, the intent of the law is to provide access both in facilities and health personnel.
Right.
And the focus of the law is to look at the difficult areas. I mean, ang tawag natin dito is yung GIDAs, ano? Geographically isolated and disadvantaged areas. The thing is, do we have enough personnel? Do we have enough physicians, nurses, dentists, or whatever,
Right.
who will be able to provide for the services in those areas?
Okay.
Aside from the fact that there are no existing clinics or even rural health units in those areas. So I think the government should be able to identify all these areas.
That's what we're going to discuss next. But Ms. Karen, you were about to add something?
Yes, I think the difference with the universal health care law is it's very specific on its priority, and it's primary health care.
Yes.
So this renewed effort to drive people to seek early diagnosis and early treatment will prevent all these catastrophic cases that PhilHealth now has to pay, and obviously that includes dialysis. So it's very important that people realize that the idea of prevention is so much more important than cure.
I think we need to reorient
Right.
and change the paradigm of things as far as healthcare in the country is concerned. We need to focus on primary care. We should let people know that before anything else, you have to go and see a primary care physician first, which is a requirement of the law. And the primary physician will be the one to navigate and let you understand and know where you're supposed to go.
Right.
And it's the responsibility also of the primary care physician to make sure that the people within his jurisdictional control, if I may call it like that,
Right.
is to make the families that he attends to healthy. And he has the responsibility of making sure that everyone that he sees will be as well given information about how to change lifestyle or how to modify the kind of life that they have, and that they should seek early attention before anything else goes complicated.
Now, does Papo have any experiences or could share some experience with regards to having measures to be able to provide good quality healthcare that's accessible to those in rural areas?
Currently, Papo is a partner of PhilHealth in terms of educating people about social health insurance. DOH has also been talking to us about a patient scorecard. This is meant to provide feedback, and the focus, though, of the scorecard is more on patient safety, but certainly moving forward, I think we need to look at technology as well, and we need to look at telemedicine, which is also being practiced in other countries which have challenges in terms of access to healthcare. So there are certainly models that we can look at. I think the more important area to focus on is to be able to access the service and to be able to make it affordable and acceptable to all Filipinos.
That's true. What is your 3-year forecast with this universal healthcare law under the Duterte administration? Let's start with Dr. Tino.
What is important is, I think we need to focus our attention on providing for healthcare for our people. So it doesn't matter if you're in the private sector or if you're in the government sector. What is important is we need to focus, we need to work together, we need to cooperate, and we need to be able to define the paths that we're targeting, the goals that we need to achieve. And I think if we are able to do the cooperation between government and the private sector, things will run positively and things will run very well.
Very good optimism, Dr. Tino. And Miss Karen.
My dream is for that patient journey to be seamless. And when I mean seamless, the patient, number one, would have enough information. Number two, he would know where to go. Number three, he would be given the proper diagnosis and be able to access the proper treatment or the proper prevention. And finally, of course, when he has the treatment and it's the end of his life, that's also palliative care and hospice care. So it's sort of a womb-to-tomb caring for the patient. That is my dream.
And that's about all the time we have for you this episode, and we'll see you again next time as we give you topics that help take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.